Questions at all on anything?
You mentioned joints going to be used for issues like mine with the back issue and or stenosis, which are the two major degenerative discs in my back and stenosis that are causing the secondary problem.
Sure, yes. Yeah, you can use stem cells, and actually there's a procedure called PRP injection, which means plasma-rich protein, which basically is just an aspect of our blood that's really good for healing. So we concentrate that, and you can inject that into the area of the stenosis and the area of the bad disc to help give your body what it needs to regenerate and heal. So yeah, that is an option. Yeah. Go ahead.
How do the stem cells stay in that area? You said they migrate naturally to the parts of our body that need them.
Correct, yeah. So we do a procedure to actually generate a little bit of, well, sometimes a lot of inflammation, but into the joint. So you already have, say, inflammation in your joint, okay? You might have cardiac issues or stuff too, they may travel a little bit, but we try to concentrate them, obviously, stimulate some inflammation there and concentrate it right into that joint so it stays right there. Now, God forbid, you only get 50% improvement, not 100% improvement. Those stem cells went somewhere else, guess what? They're needed there, yeah. So it's either saving your heart or saving your lungs or something like that, okay? Some of the other things that they do is they do IV stem cells. So, okay, which can go to the lungs, can go to the heart, kidneys, that sort of thing. So if you're having any sort of degenerative issue or, your organ's not doing as well as it should, that sort of thing, it's also important. Go ahead.
What if kidney
cells don't do is cross the blood-brain barrier, okay? So if you have some degenerative brain issues, okay? But there's actually little vesicles within the stem cells called exosomes that they actually have extrapolated, and then you can use that, which will actually pass the blood-brain barrier to help with any sort of neurologic brain disorders. Yeah, so, go ahead.
So the stem cells are finite then, right, in your body? So you're donating of your stem cells, you've depleted your supply, and it's not going to be replenished?
Correct. Yeah, correct, yeah. 90% of your stem cells are used up by the time you hit skeletal maturity. So you're going to have 10%. So it really depends on how many injuries you've had, how well you treat your body. You know, if you're a smoker, if you're a drinker, you're obviously more likely to get cancer because stem cells can't tag the cancerous cells, in order to generate that immune response. That's always occurring in all of us all the time.
So it's different atoms each person depending on what they do during smoke that kind of stuff.
Oh yeah, absolutely. Yep.
So as a follow-up to that, if you were to get, let's say you had, financially you were fine, so you could afford stem cell,
Sure.
right? Are there people who get stem cell injections just as a routine maintenance kind of thing?
There are.
I mean, people that want to bolster their stem cells?
Yes, there are. It's kind of, I mean, it's jokingly, but we say, like, really, how long do you want to live? Is like how many stem cells you can get. Really what it comes down to. It's part of anti-aging medicine. So,
right,
yeah.
so do they have any studies behind it that say that that's a beneficial thing?
Oh yeah, there's tons of studies behind it. Yeah, as far as everything. Yeah, honestly, it's like one of those things where there isn't really any sort of like negative findings as far as using stem cells. Now, just to clarify, some people say they're using stem cells, but they're actually using stem cells. They're using like placental tissue and cord blood and stuff like that. So there's a difference between stem cells and other parts of the like the fetus and those sort of tissues. So to get stem cells, really just the umbilical cord is where it's concentrated. Now you can get them from your own fat cells, from your own bone marrow, but again, you're getting like 60-year-old stem cells, not brand new stem cells, which over time they wear down, so they're not as beneficial. So you could take them, say, out of your hip and put them in your knee. Well, within a few years, then your hip starts hurting. You see what I'm saying? So that's why if you can actually replenish them, it's better. Does that make sense?
Number of stem cells you can put in your body? Like how many times you can have stem cells?
Usually an injection has about 2 to 3 million stem cells, okay, if you're going to do like a repeated injection, okay? But to do stuff like, if you want to do like Alzheimer's, dementia, that sort of stuff, you're talking like hundreds of millions, okay? So now...
What's the success rate of stem cell?
Sure.
In like shoulders or wherever?
Right, yep. Actually, from everyone that I've talked to who has done it, 90%.
Wow.
Yeah, 90%. Yep. Most of the time, you only need one injection. 10% of the time, you might have gotten 100% improvement. You might need another injection.
So in,
Give me an example, what's the worst thing that can happen to you if it doesn't work? I mean, is there side effects?
No, I mean, just that it doesn't work would be the worst
Okay,
thing.
that's worst case.
Yeah, that's worst case scenario. Again, there's a chance of infection, but no more than if you got a flu shot. You know, it's just a simple injection.
Let's see, you mentioned cost, it's cost prohibitive. What's on a single injection?
I said like for a knee or something like that, they retail at 5,600. So locally though, I called around, I already did my research, and average is about 4,200.
I paid such. Once the stem cells are inputted, then how long does it take to show some type of effect that things are better with the knee or?
2 days,
Yeah,
How many?
right away.
yeah, people say right. I mean, they notice
That's amazing.
I give people I tell them 3 weeks to 3 months just to get that buffer because not everybody has a dramatic result right away, but people do report.
I had my knee done, and I was on a crutch for 2 days, I think. And
That's it.
within 6 weeks, I had, well, the pain was gone probably that week.
wow.
Wow.
But not everybody's.
Last one, well, how come my medical doctor didn't tell me about this? Or how come my surgeon didn't give me this option? Like, well, stem cell cost compared to a surgical cost is a big difference. So your surgeon wants to make money and the hospital wants to make money. So they're a lot of times not going to be like, hey, let's try this first. You see what I'm saying? Because it does so well on fixing people.
We mentioned,
So I just kind of want to give you like a rundown of why this is kind of backwards in this country. People come in and they've tried 12 things to try to get fix their knee. I've tried ice, I've tried heat, I've tried walking, I've tried rest, I've tried swimming, I've tried chiropractic, I've tried acupuncture, physical therapy, NSAIDs, pain medication, cortisone injections, and none of them work. And then I ask them, well, did any of them make you feel better? And they go, well, yeah. And then I say, well, then they worked. They're not designed, cortisone is not designed to regenerate your knee. Okay, it actually works really well initially and then stops working. And then even less effect, and then less effect, until it doesn't have any effect at all. But they think it's a failure. But really, you're not looking at it right because it's not actually designed to regenerate your knee or regenerate your tissues like stem cell are. So it's completely different. So when people are like, well, I don't know, I tried 15 other things. I don't know if this injection is going to be the magic trick. Well, you haven't tried anything. Like, you got to look at it the right way. You know what I mean? Everything you did try didn't work, but it's not the answer. So if you're looking for the answer, I would try something like this. If you're a candidate, but yes, you have to be a candidate. That's why you got to come in and do an exam on it. You got to look at all your stuff.
are you the only one